Would you ever think that a sinus infection can be deadly? That was the case with Sarah Brodden, a 20-year-old who lost her life because she was unable to get care on their Medicaid. She couldn't afford to go to a primary care doctor, and their untreated infection caused fatal damage. Millions of people around the world have similar experiences because of the lack of healthcare access. I became interested in this topic when I moved to the US from Turkey and was hit with the fact that even in a wealthy nation, healthcare isn't accessible enough. We should all do our part to help the lack of healthcare around the world. Today, I will be talking about the lack of healthcare access, what solutions are currently being used, and how we can make a difference about it. So why can't some people exercise their fundamental right to health? According to the World Health Organization's 2017 Global Monitoring Report, up to 3.5 billion people lack access to the healthcare they need. And according to the 2018 study of the National Academy Press, 5.7 million people die each year from poor quality healthcare. The most prominent factor causing this is the cost. For almost 100 million people, medical expenses force them to survive on $1.9 or less a day, according to the WHO report from 2018. Sub-Saharan Africa and Southern Asia regions face significant challenges in ensuring healthcare, such as vaccinating their frontline workers. Basic healthcare services are becoming more available in other regions, but the lack of financial protection pushes families into poverty. Another factor that worsens the state of healthcare is global health threats, like the COVID-19 pandemic. COVID-19 has shown that healthcare isn't guaranteed for anyone, even when which is shown by when it destroyed even well-established healthcare systems like New York's. However, countries with already disrupted healthcare systems got affected by the pandemics the most. In rural communities of developing countries, accessing healthcare means long travels, and many facilities lack basic supplies such as soap and water. Nearly everything we know about the spread of COVID-19 has come through data from facility-based care, which half of the world's population just simply cannot access. This emphasizes the need for resourcing household-level care by community health workers. Now, I will describe a non-profit organization that makes this possible by bringing technology and health together. Founded in 2010, Medic builds cost-effective and open-source digital health tools to strengthen community health systems. Medic uses technology not just to build software, but to evolve and redesign health systems already implemented around the world. Their main way to provide care to hard-to-reach communities is by using Community Health Toolkits, or CHTs. CHT is a project which supports the development of digital health initiatives, which is in the top 10% of open-source projects according to openhub.net. It provides a collection of open-source technologies for government and organizations to build digital tools. According to CHT's core framework overview, more than 24,000 health workers use these tools to provide support and millions of home visits every month. CHT can support any written language, and is designed to be offline first, and it can work with occasional internet connection. According to the 2023-2025 strategic plan, Medic and CHT have supported more than 120 digital health initiatives in 13 countries across Africa and East Asia. CHT also supported care delivered by health care workers more than 92 million times. Medic believes in the promise of a new model of care, led by professional and paid healthcare workers. Now that you know about the mission of Medic, let's take a look at the Community Health Toolkits more closely. Now, imagine that you are a healthcare worker in a community with limited healthcare resources, outdated health information systems, and a shortage of healthcare personnel. Now, imagine that you have a mobile application with you that helps you with patient care at all times. Apps built with Medic's framework transform the experience of health workers by providing up-to-date patient information. Prior to visits, healthcare workers are provided with targeted patient care tasks based on proximity and risk factors. They can create a new profile for patients, or view existing family profiles. Condition cards summarize an individual's health history and status, and the data is stored locally on a worker's device, and the information is kept up to date. Health workers may not be equipped with enough information to treat some patients. In that case, the decision support of the app helps health workers through an official care guide for cases such as immunizations or family planning. Messaging allows health workers to communicate about care and be monitored by supervisors. Supervisors and nurses can also review reports from the workers and address unmet patient needs. MEDIC aims to increase the number of governments that choose CHTs as a tool from 6 to 10 by 2025. They also aim to triple the number of users from 40,000 to 120,000. As you heard, MEDIC brings a unique perspective to healthcare. Over the next decade, healthcare systems around the world must evolve to pandemics, urbanization, and climate change. MEDIC uses technology to meet the diverse needs of communities around the world, and their Community Health Toolkit is not a single product, but rather a platform that allows governments or organizations to build health toolkits. Together, we have an opportunity to support a nonprofit organization that helps thousands of health workers and millions of families around the world. Every donation, regardless of amount, will help MEDIC be one step closer to their goal. A world in which health workers are supported, and health as a secured human right feels like a dream in 2024. However, with our donations to nonprofits like MEDIC, universal healthcare coverage might become a reality. Thank you for listening.